Dane County leaders would like to stick to science over what they consider politics when it comes to public health. The state legislature may not allow that.
Assembly Speaker Voss proposed legislation would significantly limit public health department's power. News 3 Now's Naomi Coles explains.
It's a familiar theme. State Republicans have sued throughout the year, challenging the power of local public health departments and the Department of Health Services. Assembly Speaker Robin Voss's proposals would prohibit the ability of local health departments to close or put capacity restrictions on some types of businesses unless they do it for all types. The Dane County executive had strong words in response today.
Rather than an answer to our months-long plea for state government to take greater action to combat the spread of COVID-19, Speaker Voss's proposal undermines our ability to protect our residents. It takes healthcare decisions out of the hands of healthcare professionals and puts them into the hands of politicians.
I think that one of the things that has been effective about our approach here in Dane County is that we have been able to follow the science and the data, and that we have used that to really fine-tune restrictions so that we can restrict places where we're seeing spread and loosen up on places where we're not seeing spread.
According to a memo from the Legislative Fiscal Bureau, the proposals would prohibit targeted closures and restrictions, and they'd require justification, scientific reasoning, and a timeline for any mass restrictions. It would also ban public health from prohibiting church gatherings. Wisconsin law does allow local public health officials to do what is reasonable and necessary to prevent public disease. That includes forbidding public gatherings. Now, Robin Voss's proposals would also include adding staff to local public health departments. For News 3 Now, I'm Naomi Coles.
Other provisions include making virtual learning harder for schools and giving the legislature control over vaccine decisions.